Good morning, everyone, and welcome to another Medical Minute with Colorado Springs Orthopaedic Group. Today we are sitting down with Dr. Michael Huang talking about the difference between hip labral repair versus labral reconstruction. So good morning, doctor.
Good morning.
So great to be here with you today. So tell me a little bit about what the difference is between those two.
Yeah, so both are surgeries that we do to treat hip labral tears. So the labrum's a structure inside the hip that lives on the socket side of the joint. So most people know the hip is a ball and socket joint. And what it is really like a gasket of the joint. So it's a piece of soft tissue that's like an O-ring that was glued to the edge of the socket. And that can tear with certain activities or traumatic events. So the question is, well, what do you do about it? And if a patient can't survive with it, meaning if they fail physical therapy and medications, then sometimes we talk about surgery, and there are two options now. Before, we used to just go in and actually remove the labrum, and that's kind of outdated. We know that doesn't work well. So over the past 12 to 15 years, we've been repairing the labrum. That means we keep the tissue there and we try to reattach it for that patient, and then they go through an extensive rehabilitation process. More recently, over the past maybe 10 years, we've recognized that sometimes the tissue is so poor, meaning it's been torn so badly that a regular repair won't work, or it hasn't worked. Maybe we tried it and it didn't work. So the question is, what do we do with these patients? Do we abandon the joint and just go to hip replacement? Do we just tell the patient to live with it? Or now what we can do is actually put new tissue in there to give them a new labrum.
Okay, so I guess what I'm wondering is what leads to these kinds of things? What activities are people doing that might lead to them needing these things?
Yeah, great question. It can happen for all sorts of reasons, but there's a baseline common denominator, which is a lot of people will have a bony predisposition to get a labral tear. So I told you the labrum is a ring of soft tissue, but remember, it's at the mercy of the bone around it. And so when we're all born, we all have hips, and they all look a little bit different here and there. Some people have a little bit extra bone on the outside of the ball, so that when we flex up our hip, that can impinge on the labrum. And sometimes the socket's tilted a little bit to the front, and that moves the labrum to the front, and you get that impingement. So people with impingement are at risk for tearing the labrum, but not everybody with impingement gets labral tears. So then you usually need some sort of activity. So whether or not that's a hockey player that's getting in that deep squatted position, or a collision athlete, or even people that work out all the time and squat or box jump, those are people that are at risk for it, especially if they have the bony predisposition.
Okay, so let's talk more about these procedures themselves. How are they performed?
So they're both performed arthroscopically now. In Europe, sometimes they're still done with an open incision, but we're able to do them with the camera-based surgery, the arthroscope. The best thing about it is that it's minimally invasive, so it spares off all of the soft tissue trauma, and then we can get right to the joint and do the surgery. Now, the reconstruction, where we have to introduce the graft, is much more involved, as you can imagine. So it's a little bit more invasive, and it takes a little bit longer, but we're able to do them in an outpatient basis now, so patients get to come in and go home the same day, minimal incisions, and the recovery goes much faster. Okay,
so what kind of experience do people need to look out for in their physician when they're looking to have something like this performed?
Well, because it's a relatively new procedure, the whole category, hip arthroscopy in general, there aren't that many orthopedic surgeons that do a lot of hip arthroscopy. So my first piece of advice is just make sure that your surgeon's very familiar with the procedure. And then if there's some decision making between labral repair and consideration for reconstruction, you need to then go to the next line of questioning, which is, hey, do you do reconstruction? Because even amongst the surgeons that do repair, not all of them do reconstruction, because it's technically much more demanding. So we're fortunate enough to be doing that here and have great experience with it, so we'd love to take care of everybody in town, of course, but those are the baseline questions that patients should ask.
Perfect. Thank you so much, Dr. Huang.
You're welcome.
And for more information, you can go online to csog.net.
All right, thank you, Mia, and all that information up on your screen now. If you would like to get a hold of Dr. Huang or his team, you can do so at csog.net. And this segment has been sponsored by Colorado Springs Orthopaedic Group this morning.